When we see Lyme patients, it's complex. It's not just, okay, let's kill the bacteria, we're done. Especially if you've had it for years. There's a lot of things going on, a lot of other conditions. So this particular presentation, they were talking about an observational study, so basically just a survey, not a official trial or anything, and it had 39 patients. But they found that 100% of their Lyme patients had chronic fatigue syndrome, 82% had mast cell activation syndrome, 87% had SIBO, or small intestinal bacterial overgrowth. They also talked about Ehlers-Danlos syndrome and POTS, and how gastroparesis with the SIBO as well. So there are a lot of other things, a lot of diagnoses that you can have. And I know so I talked about mast cell activation in my first video, so you watch that for more details, but I did have somebody ask me about mast cell activation. Does Lyme get confused with mast cell when it's actually just Lyme and that needs to be treated? Does Lyme mean you have to retrain your brain? Or should the doctor just treat the Lyme instead of giving a person more labels like the mast cell? So the issue with the mast cell is that you get to a point where you can't really treat because a patient's reacting to everything. And so then you do kind of have to label it as mast cell and treat that and get that under control so that you can then treat the Lyme. So if you're having like a Herx reaction that's lasting like 1 to 3 days, that could be a typical Herx reaction. But if you're like trying something new and then you're having a reaction for like 2 weeks, then it could be more of a mast cell thing. And what practitioners are finding is they can't treat when somebody's that sensitive and they're having a reaction to everything. They tend to have reactions to typical medications as well because of fillers, because of dyes. So getting your medications compounded so that you just have the active ingredient and something like cellulose, something that's not going to be too reactive, might be a good idea. And then mast cell is a little bit complicated to test for. There are some things that you can do, but a lot of practitioners just kind of give you an antihistamine and see if you respond. And so you don't necessarily need to get the testing or need to add that diagnosis, but it is something that you kind of do have to address in order to get somewhere in your treatment. Because if you are just having so many reactions that you can't actually take the treatment, then you'll never be able to treat without addressing that.